All right. So this is a micro lecture. It's just going to be short, 10 minutes to try to clarify some hip perspectives and pelvic girdle perspectives. And so I gave it some thought yesterday after our study session on what better way I could explain this concept. Because again, some of these concepts aren't easy, but once you learn them and you get it forever, you're going to be like, okay, it's pretty easy now. So my job is to get you to see it, is to get you to see what I already see. But it's not that I didn't struggle with it. It took me a while to kind of understand what was going on, and then I can kind of do my job, which is come up with some simple analogies to try to help you see what's going on. So the first thing I'm going to do is swing this over to our skeleton pal. And what I want you to keep in mind is, again, perspective, right? Hip is this articulation specifically, that articulation specifically, or both articulations specifically. Pelvis is everything here. So what I mean by that is when I rotate because of my right hip and I have right lateral pelvic girdle rotation, the rotation perspective is everything. The hip motion is just this part of the pelvis. Okay, so pelvic girdle rotation includes hip, but hip does not include pelvic girdle, all of the pelvis. In other words, just because I have motion at this articulation doesn't mean I have change at this articulation or this articulation. Okay, so we have to remember hip is a very specific part of the pelvis. Again, you liken it to Louisiana being a state and Acadiana being an area of that state. And, if something happens to the state, well, of course, Louisiana is going to be a part of it. But things can happen in Acadiana that doesn't necessarily happen everywhere else in the state. Maybe that analogy works, maybe it doesn't. When you have simple articulations, such as elbow, wrist, things that don't spin in the transverse plane, things are a heck of a lot easier to see. But when you start getting into transverse, when you start getting into repositioning the eyes in the transverse, now all of a sudden things get a little freakier, okay? So to make life easier for you, I came up with this analogy, and that is joints are a relationship of bones, right? So like a marriage, it's a relationship. And so for the hip, let's see if my 43-year-old muscle tone can handle all this weight. So for the hip, you have a relationship between femur and pelvis. Pelvis. Specifically, the right acetabulum made up of the right ilium, the right ischium, and the right pubis that articulate right in there, okay? It's a very specific articulation. So what I'm trying to get to is that my wife and I, we have different perspectives on different things, and I may be in charge of kind of making decisions or seeing things from certain instances, and she may have perspectives or have responsibilities in other instances. And I'm going to explain why, but to make life easier, the pelvis or the hip socket, I'll say it like that, the socket has the sagittal and frontal perspective. There's three perspectives. The socket owns the sagittal and the frontal. The femur, or the long bone, owns the transverse in anatomical position, okay? Now, let me explain why that is. It has to be like that because if you are thank you, buddy. If you are in anatomical position and the first thing you do is externally rotate, if the femur owned the transverse plane, if the femur owned the sagittal plane, then when you externally rotate, you move the sagittal plane with the femur. So now all of a sudden, this is flexion and extension. And we know that doesn't kind of make sense. heads up. I'm not going to flex like this. So the socket owns flexion, extension, ab, and adduction, and that means it doesn't matter if I'm externally rotated. This is still hip flexion because it's the socket sagittal plane. This is going to get me more into a ball than this. Okay? And conversely, if I did this, this isn't going to be adduction or abduction, right? This is going to be more ab and adduction. So what does the long bone own? If it doesn't own sagittal or frontal, what it does own is transverse. And this is where we're going to get to the pelvic girdle rotation on a knee, okay? So be patient, follow with me. External, internal, 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 external, internal. So you see, the long bone owns the transverse plane, meaning that the transverse plane is going to move with the long bone. So when I'm in a flexed position, this is external and internal rotation of my hip. So now let's bring it back to I need to grow more appendages. So now let's see if I could bring it back to being on a knee, okay? So we're going to have to use our imagination a little bit. But if I am on a knee and I'm here, well, let's say I'm off. Internal and external, right? Internal, external, internal, external. Sorry, I keep dislocating you, buddy. So if this is internal and external, guess what moving the socket is going to look like? Internal, external, internal, external. So the point is that you're in the pelvis's frontal plane, but that means the whole pelvis. But you're in the right hip's transverse plane. Okay, I'll say that again. This is where I think the confusion is. The pelvis is not the right hip. The right hip is the right hip. And the right hip is made up of some pelvis, but not all the pelvis. So when I say right lateral pelvic girdle rotation, I'm talking about everything. The whole pelvis spinning that way. But when I talk about the right hip, I'm specifically talking about the articulation that makes up the femur and the right acetabulum. So the right hip motion is the hip's transverse, but the pelvic girdle rotation is the pelvis's frontal. Okay? If we take it to the other example where, let's see if I can do this. We're here. Again, the hip is here, horizontal AB, horizontal AD, horizontal AB, horizontal AD, horizontal AB, horizontal AD, horizontal AB, horizontal AD. So the hip motion is in the sockets, because remember, socket owns general motion, femur owns pure motion, pure rotation. So I think the thing that I need to try to get you to see in this micro lecture is pelvic girdle rotations is the whole book, the right side and the left side. And it's never lost. It's never wrong. Transverse, sagittal, frontal. Even if I'm here, frontal, sagittal, transverse. But the hip motion, that we have to zero in and say for the hip, long bone owns transverse, socket owns sagittal and frontal. Okay, I hope that helps. Bye-bye.